Welcome, dear friends. Today we are going to learn about typhoid fever. Typhoid fever is also simply known as typhoid, or it is also called as enteric fever. It occurs, or it is a it is caused due to a bacterial infection, and the species is called as Salmonella. The symptoms, they might vary from mild to severe and usually begin 6 to 30 days after exposure. The cause is the bacterium, which is called as Salmonella enterica, subspecies Enterica cerever typhi, or simply it is called as Salmonella typhi. It grows in the intestine and the blood. Typhoid is spread by eating or drinking food or water which is contaminated with the feces of an infected person, or it might also occur with a close contact with an infected person. Only humans can be infected by this particular bacterium. A typhoid vaccine can prevent about 40 to 90% of the cases during the first 2 years. The vaccine may sometimes give an effect up to 7 years. For those at high risk or the people who travel to areas where the disease is common, vaccination is a recommended therapy to avoid, or we can say vaccine is a preventive measure. Other efforts to prevent the disease include providing clean drinking water, good sanitization, and hand washing after using bathrooms. The disease is most common in India because of the poor hygienic conditions or poor hygiene practices which are followed. Children are most commonly affected. Rates of disease are decreased in the developed world from 1940s as a result of improved sanitation and use of antibiotics to treat the disease. Death rate is less, it is seen to be only 20%, and if it is not treated. So we can say if typhoid is treated, then there is no chance of death. Now let us see the risk factors. The risk factors includes working or traveling to areas where typhoid fever is established. If you are working as clinical microbiologist handling Salmonella typhi, or in close contact with someone who is infected or recently has been infected with typhoid, or you drink water which is contaminated by sewage that contains the bacterium. Now let us see transmission. S. typhi has no non-human vectors. So S. typhi is transferred only from one human to another human directly. So if the food is handled by an individual who chronically sheds the bacteria through stool or less commonly through urine, if such person is serving food to you, then there is a chance that you might to contract that particular disease. Second is it gets transferred from hand to mouth after using a contaminated toilet and neglecting the hand hygiene. Next, it can get transmitted by oral transmission via sewage contaminated water or having shellfish. The infection always comes from another human, either an ill person or a healthy carrier of the bacterium. The bacterium is passed on with water and foods and can withstand both drying and refrigeration. The symptoms are sometimes the people they don't show the symptoms if you are only mildly exposed. Some people they are going to become carriers, that means they won't show the symptoms but they carry the disease or the bacteria. The symptoms which commonly shown are poor appetite, headaches, generalized aches and pains, lethargy, diarrhea, have a sustained fever as high as 103 to 104 degrees Fahrenheit, chest congestion which develops in many patients, and abdominal pain and discomfort are most common. Constipation, mild vomiting, and slow heartbeat are other symptoms. Now let us take a look at the time frame. The typhoid, it occurs over a few weeks after exposure to the bacteria. Sometimes children suddenly become sick. The condition may last for weeks or even a month or longer without treatment. The first stage of typhoid is mostly shown by fever. It begins by high fever, bradycardia, fatigue, weakness, headache, sore throat, diarrhea, constipation, stomach pain, and a skin rash, which is called as rose spots. These are blanchable on the chest and are observed on the abdominal area. Adults are most likely to experience constipation, while children they experience diarrhea. The second stage is characterized by weakness to get up, bradycardia, weight loss, high fever, severe diarrhea, and severe constipation. Also, the abdominal region may appear severely distended. The third stage is called as the typhoid stage. When the typhoid fever continues untreated for more than 2 or 3 weeks, the affected individual may be delirious, or he might be unable to stand and move, and the eyes may be partially open during this time. He may show intestinal hemorrhage, pneumonia, dehydration. At this point, fatal complications may emerge. Now let us take a look towards the pathogenesis. When you ingest contaminated food or water, the salmonella bacteria, it is going to enter your body. After that, it is going to invade the small intestine for almost 1 to 3 weeks, and after that it is going to enter the bloodstream. Then from here the WBCs carry the bacteria in the liver, spleen, and bone marrow. The bacteria in this particular organs, it is going to multiply, and again it re-enters the bloodstream. The bacteria invades the gallbladder, biliary system, and lymphatic tissue of the bowel and multiply in high numbers. And from here it is passed into the intestinal tract, and it can be identified for diagnosis in cultures from the stool tested in the laboratory. Now let us take a look towards the diagnostic tools that we can use. Diagnosis of typhoid fever is made by blood, bone marrow, or stool cultures test. Vidal test is also done, a test involving agglutination of the typhoid bacilli when they are mixed with serum containing the typhoid antibodies from an individual having typhoid fever. It is used to detect the presence of Salmonella typhi and S. paratyphi. Typhoid test. The test is based on the presence of a specific IgM and IgG antibody to a specific 50 kD OMP antigen. It is present on the bacteria. This test is carried out on a cellulose nitrate membrane where a specific S. typhi outer membrane is attached as fixed test lines. It separately identifies IgM and IgG antibodies. IgM shows recent infection, whereas IgG signifies remote infection. Then you can also go for antimicrobial susceptibility testing. Preventive measures which can be taken for typhoid prevention are, basically it is of two strategies. The first one is you can go for vaccination. The first type of vaccine, it contains killed Salmonella typhi bacteria. It is administered by a shot. The second type of vaccine, it contains a live but weakened strain of the Salmonella bacteria that causes typhoid fever, and it is taken by mouth. So be vaccinated against typhoid while traveling to a country where typhoid is common. Need to complete vaccination at least 1 week before traveling. Typhoid vaccines lose their effectiveness after several years, so check with doctor to see if it is time for a booster vaccine dose. The second strategy is avoid risky food and drinks. Buy bottled drinking water or bring it to a rolling boil for 1 minute before drinking it. You have to ask for drinks without ice unless the ice is made from bottled or boiled water. Avoid popsicles and flavored ices. Eat food that have been thoroughly cooked and that are still hot and steaming. Avoid raw vegetables and food that cannot be peeled like lettuce. When you have to eat raw fruits and vegetables that can be peeled, you have to peel it yourself. Don't eat the peelings. Avoid foods and beverages from street vendors. The treatment for typhoid is, first you have to go for consultations. An infectious disease specialist or a surgeon should be consulted. Then the medications used mostly are antibiotics, mostly ciprofloxacin, ofloxacin, ampicillin, amoxicillin, chloramphenicol, etc. are used. Then sometimes you might have to go for surgical care. Usually it is indicated in cases of the intestinal perforation. So you can also go for diet therapy. Fluids and electrolytes should be monitored and replaced diligently. Oral nutrition with a soft digestible diet is preferable in the absence of abdominal distension or ileus. Activity, no specific limitations on activity are indicated. Rest is helpful, but mobility should be maintained if tolerable. So, the patient should be encouraged to stay home from work until he is fully recovered. So, this was all about typhoid, and thank you for listening.